Hi, everyone. Thanks for joining us today. This is Victor. I'm going to turn it over to Dr. Wolitski.
Right, thanks, Victor. And thanks, everybody, for joining us for part 2 of our webinar on the priority populations that are featured in the National Viral Hepatitis Action Plan. I'm really excited that we've got some great guests to join us here today, and we're going to be talking about some really important issues that I know affects the work that all of you do day to day. Let's kind of go ahead and get past the please wait sign. And we can probably skip past this one too, because I hope you know what day it is today. But what I will say, if you're having any technical difficulties, this is what to do. And you might want to, if you have your phone out near you, take a picture of this. You have it if something happens later in the webcast. But if you have any problems, go ahead and contact Deb LaBelle at JSI, and you can reach her by the phone number here or at dlabelle@jsi.com. Going to the next slide, we'll kind of just do a little bit more housekeeping. Want to let everyone know today's webinar is being recorded, and it will be archived, and you'll be able to access it in probably about 3 weeks from now. The microphones on your side have been muted, and we're not going to be taking live questions today, just because of the number of people we have on the call. What you will be able to do, though, is you'll be able to go into the questions pane on the GoToWebinar toolbar and type your questions in there, or any comments that you want to have. All of those will be recorded, and we'll keep a record of them. And if you have questions that we didn't get to on the webinar today, we'll follow up with you by email and make sure that you get your questions answered. So we'll do as many questions as we have time to do today, and like I said, we'll follow up later. So let's go next, Victor. Also, just really want to make sure that you all know, and I hope you've all been checking out our viral hepatitis website on hhs.gov. This is where you'll find basic information about viral hepatitis, and more importantly, more detailed information about the action plan, some tools that you can use in implementing the action plan, as well as our blog series, which features kind of hot topics and current issues that are relevant for this week and the things that are really kind of, I guess, hot in viral hepatitis at the moment. So let's go talk about what we're going to do today. We got a full agenda today, so this is the welcome. Welcome, everyone. I'll say a little bit more after this as well, but then we're going to be hearing from our Acting Assistant Secretary for Health, my boss, Dr. Don Wright, who's sitting here right next to me. And then we'll also hear from Dr. Beth Collins-Sharp, who's sitting next to Don.
Hello, everyone.
Who is from our Office of Women's Health. And I have to say that Office of Women's Health has been a great collaborator, supporter, colleague in the work on viral hepatitis, and Don's been just a great supporter in everything in the time that he's been in the acting role, and even before that. Then we're going to talk a little bit about, quickly, where we are today with viral hepatitis epidemic, and talk about some of the highlights of the action plan, just to make sure we're all starting from the same place in terms of what we know about the plan. And then really what we're going to do today is spend the bulk of our time talking about some specific populations that are disproportionately affected by hepatitis B, or hepatitis C, or who have worse outcomes as a result of those infections. And so we'll be talking to a mixture of people from around the country who are either themselves persons whose lives have been changed, affected by these infections, or they work with these populations, and they'll be sharing their experiences, their personal insights, and hopefully, for all of us, helping to give a face to the reality and the experiences that people have when they're dealing with diseases that are as serious as these are. And then finally, another one of our great colleagues here in OASH, Sinceri Cobb-Souza from the Office of Minority Health, will be coming in to talk with us and share perspective from her office and touch on some of the work that they're doing in this area as well. And then if we stick to our time, we're going to have a lot of time for questions and answers, and so we will hear from you and give you some feedback, and hopefully you'll give us some as well. So before we jump in with Dr. Wright, I kind of just want to reflect a little bit from the last webinar, where we really focused on populations like veterans, homeless, people who inject drugs, people whose life circumstance put them at additional risk for viral hepatitis. And so in this webinar, we're going to be focusing on people whose characteristics really shouldn't have had to necessarily put them at additional risk, but they did, by and large, because of social determinants of health that disproportionately put entire community of people at risk for this infection. I think the important thing that we try to take away from this is really just to kind of hear the stories, the experiences that people are having, and break down some of the barriers, break down some of the stereotypes that some people sometimes have about what it's like having hepatitis B or C, and how you got it, what it meant, what it means about you as a person. You really kind of find, the longer I do this work in hepatitis and HIV, and I find that I have so much more in common with all the people I meet than I have that's different between me and them. So I'm really excited to get to know some folks a little bit better today, and I hope that you are too.